Pharmacology, gastrointestinal system, anti-diarrheal medications, and laxatives. The digestive system is continually at work, but unless something goes amiss, you don't notice your digestive system working. This section will focus on bowel disorders that occur in the lower intestine during the final step of digestion, called defecation, when undigested materials are removed from the body as feces. During this final step, the large intestine absorbs water and changes the waste from liquid into stool. Then peristalsis helps move the stool into the rectum. Diarrhea and constipation occur when conditions occur that affect this final step of defecation. The process of defecation begins when mass movements force feces from the colon into the rectum, stretching the rectal wall and provoking the defecation reflex, which eliminates feces from the rectum. This parasympathetic reflex is mediated by the spinal cord. It contracts the sigmoid colon and rectum, relaxes the internal sphincter, and initially contracts the external sphincter. The presence of feces in the canal sends a signal to the brain, which gives the person the choice of voluntarily opening the external sphincter, defecating, or keeping it temporarily closed. If defecation is delayed until a more convenient time, it takes a few seconds for the reflex contractions to stop and the walls to relax. The next mass movement will trigger additional defecation reflexes until defecation occurs. If defecation is delayed for an extended time, additional water is absorbed, making the feces firmer and potentially leading to constipation. Alternatively, if the waste matter moves too quickly through the intestines, not enough water is absorbed and diarrhea can result. The Bristol stool chart is a chart that is used to assess stool characteristics ranging from very constipated to diarrhea. So, anti-diarrheals. Pathophysiology. Diarrhea is defined as the passage of 3 or more loose or liquid stools per day, or a more frequent passage than is normal for the individual. Frequent passing of formed stools is not considered diarrhea. Diarrhea has multiple causes, such as bacteria from contaminated food or water, viruses such as influenza, norovirus, or rotavirus, parasites found in contaminated food or water, medicines such as antibiotics, cancer drugs, and antacids that contain magnesium, food intolerances and sensitivities, and diseases that affect the colon, such as Crohn's disease or irritable bowel syndrome. The most severe threat posed by diarrhea is dehydration caused by the loss of water and electrolytes. Diarrheal disease is a leading cause of child mortality and morbidity throughout the world due to dehydration. Frail elderly are also at risk. When severe diarrhea occurs, assessment for dehydration and electrolyte imbalances receive top priority, and rehydration with oral rehydration solutions or IV fluids may be required. Common medications used to manage the symptoms of diarrhea are discussed below. Assessment. When administering anti-diarrheals, the nurse should document an abdominal assessment, frequency of bowel movements, and stool characteristics, and if there is skin breakdown in the area. Dehydration is a serious risk in patients with severe diarrhea, so priority assessments and documentation relate to monitoring for dehydration, especially in vulnerable populations of infants, children, and elderly. If signs of dehydration occur, the provider should immediately be notified and treatment initiated for dehydration. Implementation. Teach the patient to not exceed dosages of over-the-counter medications because life-threatening adverse effects may occur. Probiotics have been found to be likely safe in all populations, and the nurse can advocate for the use of probiotics in patients with diarrhea or those at risk for diarrhea because of other medications prescribed. In addition to teaching about medication therapy, nurses can also teach patients with diarrhea other non-pharmacological interventions, such as replacing fluid and electrolytes by drinking water, sports drinks or sodas without caffeine, and eating soft, bland food like bananas, rice, and toast. Children with severe diarrhea may also require oral rehydration solutions to replace lost fluids and electrolytes. The nurse should also keep in mind that anti-diarrheals should be used very cautiously with children because some categories are contraindicated. Evaluation. Because anti-diarrheals treat the symptoms of diarrhea but do not eliminate the cause of it, if symptoms do not resolve within 48 hours, the provider should be notified and other potential causes of diarrhea investigated. Monitor for serious adverse effects, such as increased bleeding in patients taking salicylates, and for abnormal heart rhythms in patients taking loperamide, and notify the provider immediately. Evaluation for dehydration should continuously occur until the condition resolves. Anti-diarrheal medication classes. There are 3 common mechanisms of action of anti-diarrheal medications. Adsorbents, which help eliminate the toxin or bacteria from the GI tract. Anti-motility agents, which slow peristalsis. And probiotics, which help to restore the normal bacteria found in the lower intestine. Oral rehydration agents may also be used in patients with diarrhea to replace fluid and electrolyte loss, but they do not treat the diarrhea. Antibacterial agents may also be used to treat diarrhea caused by specific infections, such as Campylobacter or Giardia, but they are not routinely needed. Adsorbents. An adsorption is the adhesion of molecules to a surface. This process differs from absorption, where a substance is dissolved or penetrates into a surface. Bismuth subsalicylate, or Pepto-Bismol, is an example of an adsorbent. So bismuth subsalicylate or Pepto-Bismol. The mechanism of action adsorbent medications work by coating the walls of the GI tract and binding the causative bacteria or toxin for elimination from the GI tract through the stool. Bismuth subsalicylate also decreases the flow of fluids and electrolytes into the bowel, reducing inflammation within the intestine. Specific administration considerations. Bismuth subsalicylate contains salicylate. It should be avoided if the patient has an allergy to salicylates, including aspirin, or if the patient is taking other salicylate products such as aspirin. It should not be used if the patient has an ulcer, a bleeding problem, or bloody or black stool. Children and teenagers who have or are recovering from chickenpox or flu-like symptoms should not use this product. When using this product, if changes in behavior with nausea and vomiting occur, Consult a doctor because these symptoms could be an early sign of Reye's syndrome, a rare but serious illness. Liquid products should be shaken well before used. Tablets should be swallowed whole and not chewed unless they are a chewable tablet. Medication can cause a black or darkened tongue. If symptoms worsen, a fever or ringing in the ears occurs, or if diarrhea lasts longer than 48 hours, contact the provider. Teaching and education. Patients should be advised to take medication as directed. They should be aware of potential color changes to stool that may occur and that the medication contains aspirin. They should discontinue the medication if tinnitus occurs. Anti-Motility. Anti-motility medications help to treat diarrhea by slowing peristalsis. There are two categories of anti-motility medication: anticholinergics and opiate-like medication. Anticholinergics. The mechanism of action of hyoscyamine is an anticholinergic that works on the smooth muscle of the GI tract to inhibit propulsive motility and decreases gastric acid secretion. Specific administration considerations. Read the drug label information for all contraindications, including but not limited to glaucoma, myasthenia gravis, and paralytic ileus. Diarrhea may be an early symptom of incomplete intestinal obstruction, and the use of this drug would be inappropriate and possibly harmful. Central nervous system or CNS symptoms and other adverse effects may occur that are common with anticholinergic medications. For patient education, patients should receive instructions that these medications may cause dizziness and drowsiness. If patients experience dry mouth,